Hey HOSA, I'm Dr. Julia Moffitt, Dean of Health Sciences here at Stevens College, and I want to talk to you today about your future in healthcare. I know as a member of the Health Occupations Student Association, you're thinking about things you want to do in the future. So we're going to try to clarify that for you and give you some actionable items you can do right now as a student to prepare yourself for entering healthcare. We're going to talk to three experts in their field who are also program directors here at Stevens College. Dr. Noreen Hauck, our founding director of nursing here at Stevens College. Dr. Megan Blakemore, who's the director for our physician assistant program. Maybe you're thinking about a career in medicine. And then also Dr. Dan Kissinger. He's our director for our Masters in Education and Counseling program. You may not have thought much about behavioral sciences as a career path, but it's give you some food for thought and things you can think about to prepare now. So I hope wherever you're at, you're safe and doing well. I know I've enjoyed looking at your wonderful presentations and judging those. I enjoyed that last year, and hopefully next year we won't be virtual and I can see you all in person. So come on, let's go talk to them and see what's going on. Okay, everyone. So we're up first talking to Dr. Noreen Hauck, who is the founding director of our Bachelor of Science nursing program here at Stevens College. And I know many of you in HOSA are perhaps considering a career in nursing. And Noreen's been a nurse for quite some time, and she has gone on, got her doctoral degree, and is now in charge of our program. But Dr. Hauck, I thought maybe you could share with our Missouri HOSA students a little bit about your own personal journey to a career in nursing. How'd you come to be here?
Yeah, so I'm one of the people that always wanted to be a nurse, and that's not always the case with everybody, and that's fine. And I don't know why I always wanted to be a nurse. It was just I was fixated on it from my first memories. And my mother was a nurse too, so I don't know if that probably was an influencing factor. So yeah, that was always my goal and direction. So I went directly into a bachelor's nursing program like ours. And when I graduated, I started in med surg in a critical care unit and just really enjoyed cardiology and the acute care environment and the high paced action that was involved there. But I always knew I wanted maternity. And actually, at the time I graduated was one of those few times where there was kind of a glut of nurses. It wasn't easy to get a job. You couldn't pick and choose the area that you wanted to go into. So after a couple of years in critical care where I got my certifications and everything, I went into nursing, labor and delivery. Loved that. That was just knew I had found my niche. So I did that for a long time. Then I became a perinatal clinical nurse specialist, and I enjoyed that. But back then, there weren't very many acute care roles for clinical nurse specialists. So I went into education and continued to work, part-time. And then I found that I really liked designing courses and curriculum and getting that big picture of why do we teach what we teach and when we teach what we teach. And so that kind of has been the rest of my career.
Wonderful. How many babies have you helped bring into the world, do you think?
I have no idea, but at the time, people had just started videotaping births. And so I'd go to the grocery store and people would be like, oh, we just saw you in my sister-in-law's birth video.
Oh my goodness. You really get to know, I think, nurses are part of the community. You're really taking care of people in the community. And so that's really interesting. So what do you think high school students, let's say we have a middle schooler or high school student right now thinking, I think maybe nursing might be for me. What kind of things should they be doing right now to prepare for that?
Well, nursing is one of those careers that everybody, you say nurse and you have an image of what a nurse is and what they do. But what nursing really is doesn't necessarily jive with that image. There's so much more to it. And if you're working in a hospital environment, that's really its own culture of itself. So I think if you're interested in nursing or healthcare, getting a variety of experiences in it, so you know what you do, you can see what the lifestyle and the work environment is like. One of the things that really, attracted me to nursing when I was considering, is this really what I want to do, is that it wasn't a sitting behind the desk kind of job necessarily. And the younger self was very attracted to the idea that you're thinking, you need to be knowledgeable, but you're doing something. So we're in applied science. We're bringing science to the bedside, to people's lives. And that really excited me. Working in a team, working in that kind of environment where you know how to care for people and know how to help them. I think for me, being somebody who really wanted to help other people was probably my first big reason for going into nursing.
Yeah, and I can see where our Missouri HOSA students they're doing a lot of group projects, working together. So anytime working in collaborative environments, you want to keep doing those sorts of activities.
Yeah, and you don't need a lot of healthcare experience, but I think making sure you know what the work style is like, what the environment is like. It's very different than working in a bank.
Yeah, right. Yeah.
Especially early out.
Okay. So you're the director of our Bachelor of Science Nursing program here at Stevens College, which is a new program. What do you think makes this program so distinctive?
Well, it's an amazing program. It's really, I love, like, I said earlier, I got into education. I love the idea of creating a program from the start that meets today's healthcare needs. That's really forward thinking in what healthcare needs today, and nursing in particular. So one of the big distinctions of our program is that we're a direct entry program. So we're selecting people to come directly from high school, or if they have prior college, into our program. There's not a secondary admission process like some programs will accept you to the college and then you apply later to the major, and that hinges your decision on whether you get into the major. That's a distinctive characteristic, but I think really the big thing is the breadth and diversity of experience students are going to get in the major. So Stevens College, just by its nature, has a strong commitment to its students. So I think the direct entry shows our commitment to the students and going through the program. And then getting, as broad-based experience as you can get, coming in and working with our health sciences department so that we know we have the supportive courses that are talking about issues that are healthcare issues. We really start ethical issues right in their first biology course, and that kind of topic carries through the program. So our graduates graduate with really solid experience, good decision-making skills, and ready to function as part of the healthcare team.
Yeah. And we also have this nice partnership with Boone Hospital, which is just, literally right across the street. You want to talk a little bit about how that's the difference?
Yeah, that really speaks to that experience piece, right?
Yeah.
So we have this fabulous relationship. They've created a state-of-the-art simulation center right in the hospital on a patient care unit. So students will be working with these high-fidelity simulator patients on one unit that's decked out like a nursing unit. And then next door, we're taking care of real people in the hospital setting. And Boone has opened their arms to our students to welcome in as a community member. We're part of the team. So it's really, and it literally is like another building next door on campus. So that tight relationship, I think, gives us that really strong. And Boone Hospital is a magnet status hospital, which is all about the quality of care a hospital provides patients. nursing care. I always tell my students, there's many reasons people end up in the hospital, but the reason they stay in a hospital is for nursing care. That's why you're admitted.
Yeah.
And so having that tight relationship and such excellent examples of clinical experience.
The nurses are clearly one of the most important, play one of the most important roles in treatment of the patient. And they're right by the bedside and with that nursing care. If you're thinking about, hey, I want to go into the health professions, thinking about nursing, how's nursing different than the other members of the healthcare team, and not only just the patient, but your career later on or potential?
Okay, so one of the, I think, really big differences with the nurse is how personal nurses are or intimate in that moment in a patient's life experience. So if you want to be a nurse, you want to be somebody who has a lot of empathy, has real caring, has a lot of knowledge and skills, but is really looking to understand the human experience and improve it and be there for your client, your patient. And I think the closeness of that relationship is very different than other healthcare professional relationships. And sometimes I think we're kind of the martyr in the healthcare system because we're everywhere. And we're the ones that end up saying, hey, you know what, you need physical therapy. We're going to help. We're going to be caring for you and work that in, working with the pharmacists, working with the physicians. So it's a very pivotal role. We're often the last line of defense for the patient. We get very protective of our patients and trying to make sure they're getting the best care possible. There was a second part to your question.
Like for long-term careers, just in nursing in general.
Well, that's the thing. In nursing right now, it's so diverse. There's so many things you can do with a bachelor's degree in nursing. So a lot of young nurses know specifically what they want to go into or want to get a lot of acute care experience early on. And then there's public health nursing. Public health nursing. I think everybody's heard of it now.
Right. Yeah.
There's, you can work for private industry like insurance companies or pharmaceuticals. But there's also so many different specializations. And most nurses will change their career a couple times, like I did, from critical care to OB and then to education. But nurses go into, I've had students who graduated with me who identified a healthcare need and kind of became inventors. So then they created like little bumpers for end tables for babies to not knock their heads on. Somebody creates little things we come up with. And lawyers, working in
in the legal field.
In the legal field, public policy, advocacy, politicians. So it's a really strong foundation, and it's also a good foundation for a lot of graduate programs. Becoming a nurse practitioner, there's ways you can advance in nursing. You can go and do research, but there's many other avenues that it can be a precursor for physician assistant program.
Yeah, and we'll hear from our director of our PA program here in a bit. So yeah, that's a very good point. It's nursing is very flexible. It's like you said, we have in our minds who a nurse is and what a nurse does, but it's much more vast field and opportunities now. Speaking of now, you were mentioning public health, and COVID is a huge problem we've been dealing with for the last year. And our nurses have been our heroes on the forefront of this, in the front lines. And we would not be able to solve this crisis without our nurses. How do you see nursing emerging on the other side of this pandemic, and how might it this has changed nursing? What are your thoughts on that?
That's going to be interesting. One of the things that I think the pandemic has highlighted nursing, like nurses haven't been highlighted before, and they've seen just the lengths that we go to be there for our clients through this horrible journey that it's been. And I think that they've, when they call them the heroes, the spotlight really has been on the healthcare team trying to find the treatments that work. If you look back over the last year, and nurses are there looking to respond to what their patients need. And that's kind of essentially what nursing does, especially at the bedside. And what I think the profession has done is, really tried to create safe space while the scientists are doing what they're doing and finding cures and diseases. So I think that's an interesting mix. And now that a vaccine is coming out and rolling out, I hope that spotlight stays on nursing following this. I think that it elevates the discussion. I think that it shows some of the things I've seen in the media show the real work of nurses, like really working together to handle patients that have a lot of complexity, a lot of different things happening at once with this disease. If you have comorbidities, meaning other diseases that you had before you got COVID and what the effects of those are, it's complicated, right? And it takes a team. And it's the nurse often who's the first one to recognize a change in the patient, for better or for worse, and gets the response team there at the bedside. So I think that's good. Nursing's kind of been a quiet profession, and having that spotlight on us, I think, can only be good to see the good work nurses do.
Yeah, I couldn't agree more. I think nursing is an exciting field to be a part of right now, and I hope students think about this when they're considering their careers in moving forward in the health professions. Well, I know, Dr. Hauck, you're very busy, so we'll let you get back to educating future nurses. And if anyone listening to this has questions about nursing, feel free to hop on our website and you can get a hold of Dr. Hauck or me or anyone at Stevens College, and we'll be happy to continue the conversation. Thank you for your time, and I hope you have a good day.
You too. Thank you. Bye-bye.
Okay, thank you for joining us, Dr. Blakemore. We're so excited that you're going to share your time with us. We have our Missouri HOSA students listening to this presentation, and Dr. Blakemore is our director of our physician assistant program, our Master of Physician Assistant Studies here at Stevens College. And she herself is a practicing PA. And I thought we'd spend a little time with you today so you can tell us a little bit more about things students can do to prepare for a career in medicine and being a physician assistant specifically, and just tell us a little bit more about the program. So you're a PA. Maybe tell us a little bit about what your journey was to becoming a physician assistant.
So I went to college first to be a history teacher, actually.
Oh, okay.
Then I went into the Army as a medic, and I thought I was going to do physical therapy. But what I found was, while I liked physical therapy, we weren't able to diagnose or treat a patient. So physician assistant was the next logical step on that. And PAs are used quite often in the Army.
Okay.
So I had a lot of mentors. I worked in a family practice clinic, and there was a couple of PAs there. So they really guided me towards the profession. And the Army also had a PA program, which I thought I was going to go through, but ultimately ended up getting out of the Army and going to school at Missouri State to be a PA.
Okay. So when you were in high school, you weren't thinking anything health related at that point in time?
No, not really. My grandmother was a nurse, so that was always kind of a question. But I really liked history, so I thought I wanted to be a teacher, which I ended up doing. Yeah.
Okay. Very good. So tell us a little about you work as a PA over at the VA, and how's the role of the PA differ from other members of the healthcare team? I mean, you all are trying to deliver excellent patient care and diagnose and treat patients, but what about how do physician assistants operate compared to other health professions?
So healthcare anymore operates almost exclusively in a team. Those teams are specialized. So I worked cardiothoracic surgery for 13 years at the VA hospital. We have 3 surgeons and there's 3 PAs. And of course we have pharmacists on the team and social workers. And the job of the PA was to round in the morning. Of course, your surgeons round with you, but they ultimately go to surgery every day with one of your colleagues. One of us would stay in the ICU and one of us would go to surgery to work with the surgeon. And the PAs that stayed outside in the ICU, we saw patients every day, ordered x-rays on them, ordered medications, did a physical exam on them, talked with social workers if that patient was going to discharge to how they might get home and what they needed at home, read x-rays, things of that nature. So you act as very similar to the role of the physician. They just have a more specialized knowledge, but you're still able to diagnose, treat, prescribe medications, and perform procedures such as chest tubes and central lines, art lines, things of that nature without the surgeon being there.
Okay.
Yeah.
So doing those procedures then, how does the training differ? Like you're doing some really invasive procedures and operating at a level very similar to a physician, but the training's a little different, isn't it?
Right. So our training is 27 months for this program, and that's about the average for PA programs across the United States. So we're trained, and I was taught how to do procedures just as you are in this program. When I was in school, we are more procedure heavy. We have a couple of different faculty members that have worked in cardiothoracic surgery here, so we have a little more expertise. But we do a lot of hands-on training. That's the nice thing about being a PA is you're not locked into one specialty. So you'll work with a surgeon or a physician, and they train you further on those types of procedures. So you get a lot of hands-on practice. And in a specialty such as cardiothoracic surgery, that takes quite a bit of time. But most procedures you learn fairly rapidly.
Okay, so you do a lot of on-the-job training after you complete that your formal education.
That's right. And you can do that, and you can switch specialties. So if I decided that I didn't want to do cardiothoracic surgery, say I wanted to go into dermatology, I could go get a job in dermatology and learn those procedures and those skills and then stay in that job, or I could switch to something like pediatrics if I wanted to.
Where if you went the medical school route, you specialize in one area and then you're locked in.
Sure.
Yeah,
Right.
That's true. So what do you like the most about, what do you think is the most gratifying about being a physician assistant?
I did enjoy clinical work, but I definitely have to say this job I find more gratifying. I do enjoy teaching the students and watching them grow from the first year in the program to the second. And yeah, I would definitely say it's teaching them.
So you enjoy really shaping future colleagues.
Right. And they're going to help just, an unmeasurable amount of people throughout their lifetime as being a PA. So that's always fun to realize too.
Great. So a student, one of the students watching this right now is thinking, well, gosh, that sounds great. What do I need to do as a high school student right now? What would be a little bit of advice you'd give them to prepare if they wanted to eventually become a PA?
So always get the best grades that you can. But I think the most important is if you're thinking about the healthcare route is to get as much experience as you can. Spend as much time as you can with different healthcare professionals. If you want to be a PA, try to spend as much time as you can with a physician assistant and shadowing. That's something that's hard right now, but you might be able to get a job at one of the facilities. Oftentimes I'll see young people get jobs over at the University of Missouri or a Boone Hospital just as a patient care tech, and then they move up into different areas. And sometimes they'll branch out. They'll work in cardiology for a while, and then they'll go work on a floor. And that really gives, I think, that person a well-rounded idea of what they might like to do. Or do they want to do something sports related, or do they want to do physical therapy? Is that what they're seeking? Or maybe they do want to diagnose the patient, or maybe X-ray is something that they're interested in. So I think seeing how all those professionals work individually and together is very beneficial. So I would get as much experience in different places, I think, as I could.
Yeah, I think the patient care technician route is a very great suggestion because they're going to be able to see all the healthcare team operating in different scenarios. They'll see a lot of things in that healthcare environment that, you know, they may go into it thinking, oh, I want to be a PA or I want to be a nurse or something like that, and then see another member of the healthcare team and then just really kind of gravitate towards that. So I think that's great advice. While at the same time getting that direct patient contact experience that's so important in shaping those professional behaviors. Yeah. So what are some of those other things? So they need to get good grades in science, and getting some experience in healthcare. Is there anything else that you would recommend students, high school, middle school students think about doing to really prepare themselves for being a great future healthcare professional?
I think any type of leadership activity that they can become involved in where they make a decision
Mm.
on their own is probably where I would say is the next area. Yeah, any type of leadership where they can make a decision on their own, anything that will add a little bit of growth and maturity at such a young age, I think will help that person be more independent and be able to make their own decisions, which I think will lead to more experience and better grades. And then you'll be better prepared to enter a professional program, such as the physician assistant program.
Yeah, great. And then your first stop along the way, obviously, is to get that undergraduate preparation too. So picking an undergraduate institution, what do you think are the keys to picking a good program to get that bachelor's preparation before they apply to a master's program?
Well, personally, I think you should pick a program that's a school that probably has a very good allied health program and health sciences program. But I also think it's important to pick a program where you'll have a lot of time with the faculty there, where you might even need a lower number of students, where you'll have more interaction with that health sciences faculty. I think that mentorship that they provide will help you choose which healthcare path or which healthcare profession that you'd like to enter. I think sometimes in a large school you can kind of get lost a little bit and not have that personal interaction.
Yeah, I think that's great advice. I know it's always helpful for me when I'm writing letters of recommendation for students that I've been able to really get to know them in classes for when they're applying to the PA program or other programs like that. That's a definite benefit. So you've been you're our director of our Master of Physician Assistant Studies program, which has been really successful. What do you think is so distinctive about our program that has allowed it to become so successful?
I think the major thing is the faculty that we have. We only take 30 students. We do spend a lot of time together, and the faculty is here every day with the students, and we're available to them, and we do a lot of mentorship. And I think that really makes a difference to have, we think we've got 6 PAs now on faculty, and it's just a wide variety of experience for each one of the faculty members, and we're all invested in making sure that they complete this program and they can be the best PA that they can be. I think that's the biggest asset that we have for this program. The second is definitely our facility. We have a newly renovated facility that the PAs have.
Yeah, shown right here in the background.
That's right. They have 24/7 access to this building. On the 3rd floor, we have a lab up there where we do our dissection, our cadaver dissection, and we still have cadavers, which I think is really important piece of this program, where some just have a simulated cadaver lab, so you don't get a hands-on experience in using the instruments and things like that. It's on the 3rd floor. It's well ventilated. It's one of the nicest labs that I've ever been in. So the facility is excellent. I don't think you could find a better facility for PAs.
Yeah, I would tend to agree with that. I've been in several different anatomy and cadaver labs, and it's definitely a beautiful laboratory and facilities. This is Sampson Center for Health Sciences here shown in the background, which is where our PA students and also some of our nursing students spend their time studying. So Dr. Blakemore, I know you're busy, your phone's rang twice since we've been doing this interview. So maybe just as a final question, we're going through a pandemic right now with COVID-19, and I'm sure you've seen a lot of things happen in healthcare. How do you think the future of healthcare is going to change as a result of what we've been going through, and how might that affect these students who are preparing to enter the workforce down the road?
Well, I think healthcare is going to become more flexible. I definitely think that. I think we've seen that telehealth has a lot of advantages, and it has a lot of uses that probably weren't thought of before. Leading into the PA profession, that's going to allow flexibility for us. The PA profession was just voted the #1 job in the United States recently.
Wow.
So I do think PAs will enjoy more autonomy. They'll be able to practice more on their own. There's several things that came out of the pandemic that removed barriers for PAs to practice to the top of their scope. And I think that that's helped. And this has been seen across the board in several states. And I think that will greatly benefit our profession. But I definitely think autonomy will be something that PAs see in the future.
Okay, wow. So this is an exciting profession to be a part of now.
Right.
Very good, stable salaries. And then it sounds like PAs are going to be called on even more in the future to deliver patient care. So, moving to the future, that's, I think, important, and what students want to know now, like what's happening now, but what's going to happen whenever I hit the workforce. So that's great.
Well, sure. You're going to have a job. It's a program that you go through, and then you're going to have a job afterwards.
Yeah. Yeah. Well, that's great. Well, thanks so much. I'll let you get back to work here. Appreciate you spending time speaking to our Missouri HOSA participants today. And if you have any questions for Dr. Blakemore, you can hop on our website, stevens.edu, and you can find our PA program, and you can send an email to our admissions program or the PA program, and they'd be happy to talk to you more about that if you're interested. Thanks, Dr. Blakemore. Have a great day.
Thank you, Dr. Moffitt.
Yeah, you bet. Okay, well, up next we have Dr. Dan Kissinger, and Dr. Kissinger is a licensed counselor and healthcare practitioner, and he is also our director of our Master of Education and Counseling program here at Stevens College. And I thought we'd take a few moments to talk to Dr. Kissinger about counseling. I was pleased to see when I was judging some of the presentations for you all at Missouri HOSA that some of them were directed towards mental health and behavioral health. And so I know some of you are thinking about gravitating towards this field, and hopefully Dr. Kissinger has some good insights for us. So Dr. Kissinger, maybe you could tell us a little bit about your particular journey in moving into counseling as a career path.
Well, thank you for having me. I'm glad to be here. I took a path that's not uncommon to a lot of people, where I tried other things prior and kind of came back to counseling. It was always an interest of mine, but I, for a variety of reasons, just didn't think it was the right time or didn't know I could do it. And I finally kind of found my way back, which is very common among a lot of people, where counseling kind of finds you versus you identifying it right away that's what you want to do. So my background, I was a psychology major and really liked those courses and thought of being a counselor. But I also had kind of an athletic identity in my life. And so I ended up going that route first. So I eventually came back to counseling and got my master's in counseling. And then it's just been a steady path of working as a practitioner for several years. And then I went back and got my doctorate in counseling and moved into higher education.
Okay, so I'm just going to kind of follow up real quick. When you were working in counseling and working with clients, what were some of the most gratifying things that you experienced as a part of doing that work?
I always thought one of the most amazing things about being a counselor is of just, and it does sound very cliche to a lot of people, but it's just being with people on their journey. A professional counselor is not, giving advice of how somebody should live their life. It's just kind of providing a setting where somebody can kind of honestly and safely explore what's going on with themselves and, work on goals that will help them increase their wellness. So, the fact that people would kind of tell me their stories that maybe somebody they've never told anybody else has always been kind of amazing to me. And so I've always found being with people as they're processing and maybe identifying issues in a way that maybe they hadn't considered before is really very humbling and an honor. And so that's always, if you would break it down, I would usually just kind of come to that kind of ground floor benefit.
Yeah, and I think that's one of the nice traits. So I see a lot of young people today who are really truly interested in helping others, and it sounds like this is a type of profession where they could really attain that.
Yeah, it very much is. And a lot of times when we interview people when they want to come in the program, we hear over and over again, why do you want to be a counselor? And really it's very common to hear, I want to help people. And that ultimately that's what we do. And while that seems like a very general statement, that is kind of, until you kind of have a more sophisticated understanding of what a professional counselor does, that is a very, honest and real, position to take. If you want to help people, counseling is a profession that may be a good fit for you.
That's great. So in your journey, like, let's say you could jump in a time travel machine and go back uh, to the age of our audience right now. What might you do a little bit differently that they could learn from?
I think, well, with the benefit of hindsight, um, I really didn't, I knew I was interested in kind of people's stories and what was, even though I wasn't really verbalizing that or questioning people on it, I was kind of interested in what was going on around me. And so with the benefit of hindsight, what I would do is probably look for just a part-time position. If I was in high school or something like that, I would look for a part-time position, like at a behavioral health center, a mental health center. If you could just get in there and get a job, even doing desk duty or something like that, where you could simply be around different mental health professionals and see what they do on a daily basis. The paraprofessionals, people with bachelor's degrees in psychology, a lot of times do case management work. The master's degree people and doctoral level people will be doing the individual and group therapy and things like that. And everybody works together. But I until I was in my master's program, never had any understanding of how that all works together. So if you could even get just a part-time job doing something like that exposes you to the behavioral mental health system would be a huge benefit.
Okay, and I think you raised an important distinction there, is that at the bachelor's level, you're not really directly interacting with a patient or a client, where it takes getting to that master's level to have that level of responsibility.
Right. At least in counseling and the other mental health disciplines, at the bachelor's level, you can do a lot of case management. So you would be working with clients, but you wouldn't be doing the therapy.
Therapy,
You'd be
right?
working on you'd really be kind of working with them on the treatment plans that the therapist, the professional counselor, or the licensed social worker put together with that client, and then you kind of spend a little bit more time with them and kind of seeing how working that treatment plan out essentially.
Okay,
So,
that's a great distinction to raise there. So for our students that are right now, like, let's say in high school, and they're thinking about their courses coming up next year, what might be some good academic coursework or things they might want to consider in their, let's say, their senior year in high school, if they're thinking about behavioral health as a career path?
yeah, there's a number of things. It's important to note that counseling does not have is not a bachelor's degree program. Counseling is only graduate level work. So, you're probably not going to see at the high school level, or, or even your undergrad, you're not going to see a lot of counseling courses that are titled counseling. You're going to see psychology, social work, human development, human services, those kinds of things. Any of the courses in those areas would be particularly helpful. Because counseling, if there's courses on, human behavior, personality, abnormal psychology is one that you might have a chance to take pretty quickly, maybe even in high school. So those kind of courses are a really good kind of baseline content for coming into a counseling program. At the bachelor's level and human services, anything like that, substance use or abuse, anything that just kind of gives you a sense of people's behaviors and kind of human development, lifespan development, those kinds of things would be excellent choices.
Yeah, and I think we even have a lot. I've seen more high school students come in with a psychology course, just a Psych 101 course, and I think that's a huge advantage because you sort of begin thinking about human behavior and the underlying factors behind motivations and just the way we human beings go about our lives on a day-to-day basis, the things that kind of motivate us to do those things. So in terms of selecting undergraduate majors then when they go to college, because they would need to do a bachelor's degree and then apply to a master's program in counseling, what might be some good fit for majors? You mentioned psychology. Are there other majors too?
Yeah, well, I appreciate that question because because counseling doesn't have an undergraduate kind of program. A lot of times, students aren't exposed to counseling as its own discipline. Uh, Oftentimes, I was a psychology major. I didn't know that counseling was different than psychology or social work. So that's really important. But in terms of the kinds of majors that come into counseling, we draw from all different kinds of areas. So you can imagine psychology is a lot of our students tend to be psychology majors, but we also draw from health sciences, human services, substance abuse, human development. We've had one of the nice things about being able to go into a master's program in counseling is we're gonna look at that person as a whole. So if you came from, like, we've had several journalism major students over my career come into the program. So if you come into the program and you have a goal of helping people and you have the skills, and the drive to do that kind of work, don't rule out counseling as a profession, because we have numerous people that come from majors that you might not think initially would be a good fit for counseling, but they in fact are very good fits for counseling and do very well and have long careers.
Okay, that's good to know. And I know here at Stevens College, we have psychology and we also have a human development major. And we actually do have an undergraduate course where students can explore counseling as a field at that undergraduate level. So that's probably a good thing to think about if you can find it to take a course like that. You're mentioning the journalism made me think, it seems like, and correct me if I'm wrong, there's a lot of communication involved. So anytime students could do things to maybe sharpen their communication skills, that might be a good thing for them to be involved in terms of extracurricular activities or things.
Absolutely. Counseling is, as you can imagine, a relationship-based profession. Relationships are at the core of what we do. But we also communicate. It's critically important for professional counselors to be able to communicate well in writing as well. So, the journalism majors, of course, are excellent writers, at least in my experience. And that's helpful because a lot of the work that a professional counselor does is documenting the work that they're doing with clients. And even though clinical writing is a little different than, kind of prose and things like that, it is vitally important. And so when you're thinking about the kind of tasks and responsibilities that you might be doing as a counselor, you'd certainly be doing the therapy, but a lot of what you're doing also is treatment planning and all of those and writing good, smart goals that are clear and measurable. And that's a real skill, and that takes time to build. So don't just think about, the relational piece, which is critical, but thinking about what can I do to increase my writing skills and my understanding of human behavior in terms of verbal and nonverbal communications, because those are all key.
Yeah, those are great points. So when we think about the healthcare team. So delivering good healthcare, everybody in that team is looking to help diagnose and treat patients for whatever condition they have. When we're thinking about the role of the counselor, how do you see that role in counseling a counselor plays in that healthcare team versus, say, a physician or a nurse or other healthcare practitioners?
Well, you kind of went out a little bit there, but
Oh, sorry, I didn't.
Yeah.
Let me go ahead and repeat, because our audience may not have heard me as well. I was thinking we all want to treat. The whole goal is to diagnose and treat patients appropriately, and it takes a whole team effort to do that. And I see the counselor as another key member in that healthcare team. How do you see them differing versus a nurse or a physician or another healthcare practitioner?
It's a good question. A professional counselor, the only way to kind of frame a professional counselor is from an interdisciplinary standpoint. Now we are trained. We have our own identity as counselors, but we work day in and day out with social workers, rehabilitation counselors, psychiatrists, psychologists, marriage and family therapists, probation and parole officers. I mean, it just really, there's a large number of different people from different disciplines where we interact with, and just it's integral to treatment planning and things like that. So, becoming a professional counselor, if you were doing private practice, you might be a little bit more isolated and kind of working with just a few people. But if you work in community agencies or hospital systems or private psychiatric or mental health facilities, you will just innately be working with mental health, behavioral, medical professionals, nurses, PAs from all of those disciplines. Maybe not every day, but it's unlikely you wouldn't have some kind of interaction if there's a behavioral mental health issue going on and they're getting some kind of treatment, that you'd want to, if the client allowed, be able to collaborate on a treatment plan so that everybody's on the same page and working towards the same goal.
Okay, so you may be a standalone provider for a patient, or you might be working alongside other healthcare professionals, like a psychiatrist whose role is to prescribe medications if the patient needed it, and then you would be delivering the therapy counseling, or you may be the only person that person is seeing. So it can vary quite a bit, if I'm hearing that correctly.
Yeah, and in counseling we say it depends a lot, because it depends a lot. But
Yeah.
in this sense, if you were a private practitioner, for example, if you had a private counseling practice, there may be many clients that you see that you're just seeing that client and you're doing therapy. With several other clients on your caseload, you may be doing the therapy and they are seeing a psychiatrist for their medication. And so if the client would allow, you could talk with the psychiatrist and make sure that everybody's on the same page, but you wouldn't be doing the medication management or anything like that. Counselors aren't trained to do that. But it's important to understand, to have all the information you can. If a client is taking certain medications, you'd want to know that and build that into the treatment plan if need be.
Well, I won't hold you up anymore. I know you're very busy running our counseling program here at Stevens College, Dr. Kissinger, but we really thank you for your time. And I hope students out there listening are contemplating behavioral and mental health as a field, because it's something we all need so much. So I'll let you go. And if students have any questions, they can contact me or you. We're on the website and ready and available.
Sounds great. Yep. Feel free to contact me anytime.
Okay. Thanks so much. All right. What'd you think? Pretty smart people we have here. We're pretty fortunate to have those individuals in charge of our programs here. So hopefully Dr. Hauck, Dr. Blakemore, and Dr. Kissinger gave you some good information that you can think about in preparing for your future in healthcare. No matter what field you go into, we want you to be successful. And then think about Stevens College perhaps in continuing your education. feel free to contact me. I'll make sure my information is included in this video, and you can contact any of our directors for further information as well. Have a great rest of your semester, and again, I hope to see you next year in person. Take care.